This video will discuss how to properly record vital signs while a patient is receiving anesthesia in the operating theater. Before discussing how to write down the vital signs, we must understand why vital signs have to be recorded in the first place. When patients undergo any kind of anesthesia or have any kind of surgery, they can become unstable very quickly. Thus, it is necessary to keep close track of the patient's status at all times in the operating room. That is accomplished through frequently checking vital signs. The medications given to a patient for anesthesia, whether regional, spinal, or general anesthesia, for sedation, and for pain control, can all affect a patient's hemodynamic stability. Therefore, it is important to monitor a patient's response to those medications. Lastly, a patient remains vulnerable to hemodynamic changes in the postoperative period, and to accurately diagnose and treat a patient, particularly in the first several hours postoperatively, it is imperative to know what the patient's status was intraoperatively and what medications were given. Upon a patient's arrival to the operating room, the patient's details should be recorded at the top of the paperwork. This includes patient identifying information as well as the operation being performed, the type of anesthesia being given, and the date and time that the patient arrived in the operating room. To record a large amount of information in a short time and using a single sheet of paper, shorthand notation has been developed for recording vital signs. Take some time to familiarize yourself with the symbols used on this form. Specifically, there are arrowheads pointing downward and upward for systolic and diastolic blood pressure, an X for the respiratory rate, a dot for pulse, a circle for oxygen saturation, and a star to indicate the start of anesthesia. These symbols are used on this chart. Make note that the x-axis, or horizontal axis, represents time. Time 0 is when the patient first arrives in the operating theater. There are lines every 5 minutes, which is how often the patient's vital signs should be recorded, from the time he or she enters the operating theater until the time he or she leaves. The y-axis, or vertical axis, has a number scale. This same scale is used for all vital signs. Standard units are used for each vital sign. To record the vital signs, you must be familiar with the monitor being used to measure vital signs. The blood pressure is represented by two numbers, systolic pressure written above diastolic pressure, with the mean arterial pressure written in parentheses below. On this monitor, those measurements are written in purple. You can see the patient's blood pressure is 161 over 113 millimeters of mercury, with a mean arterial pressure of 128. The pulse is labeled PR on this monitor and is written in green. You will notice that it changes fairly rapidly as the monitor constantly recalculates the pulse rate based on the time between individual heartbeats. The oxygen saturation is written in blue. To the left of the number is a vertical bar which lights up with each pulse of blood flow. The height of that bar represents the strength of the signal. If the signal is not very strong, the oxygen saturation may be inaccurate and the probe should be adjusted on the patient's fingertip. Begin recording the vital signs on the anesthesia record from as soon as the patient arrives in the operating room. This is important to get a baseline before any medications have been given and before the procedure has begun. Look at the bottom of the chart. Time 0 is when the patient first arrives in the operating room and is the first set of vital signs you need to record. Using the symbols we have already described, mark down the systolic blood pressure, the diastolic blood pressure, the pulse, the oxygen saturation, and the respiratory rate. From this point on, every 5 minutes you will record a new set of vital signs. Initially, recording vital signs will seem difficult and unfamiliar. However, as you practice, it should get easier and easier, and you should be able to record the vital signs more and more quickly. Continue to watch the vital signs monitor. When it has been 5 minutes from the last time you recorded vital signs, once again chart them in the appropriate place on the form. Whenever any new medications are given, record them in the medication box of the form. Every 5 minutes, record the vital signs again. When anesthesia is begun, make note of this on the timeline by marking it with a star. Don't forget to also write the medication that was administered for anesthesia. Continue to watch the video to notice what the vital signs are on the monitor and how those are recorded on the form. Over time, you will start to be able to see on the form not just the vital signs at individual points in time, but also the trend of the patient's vital signs over the course of the operation. It will be easier to notice if the blood pressure changes up or down, if the pulse suddenly increases, or any other changes. By having the medications and the vital signs documented on the same timeline, it also becomes easier to notice the effects of specific medications on the patient's vital signs. It is important to not only write down the patient's vital signs, but also to respond appropriately when there is a problem. Now turn your attention to the 2 boxes at the bottom of the form. These provide guidance on how to respond when the patient has abnormal vital signs. First, the box on the right gives specific instructions on what a nurse or nursing student can do to address an immediate problem. These actions can be taken without notifying the surgeon and can often fix a problem quickly before it becomes worse. If the patient's oxygen level is low, this box instructs that the patient should be given oxygen by nasal cannula. This will fix desaturation in a majority of cases. If it does not, the next line instructs that oxygen should be given by face mask. The second problem addressed in this box is what to do if the patient's blood pressure is low. Initially, the IV fluid rate should be increased to running at maximal rate via the existing IV. If the problem persists, the last line of this box instructs that a second IV should be started and additional IV fluids given. Not all problems will be resolved with these maneuvers. The box on the left indicates situations that require the attention of the surgeon. If any of these situations exist, the surgeon should be notified immediately. If the pulse is very low or high, if the oxygen saturation remains abnormal after the initial maneuvers, if the blood pressure is very low or high, or if the patient is not breathing appropriately. These problems may require the administration of medications. It is important to be familiar with the different medications commonly given in the operating theater and how they are dosed so that you can follow the surgeon's verbal orders promptly. Remember that many things can go wrong during anesthesia or an operation, and often the first sign that a patient is not doing well is a change in vital signs. Therefore, take this responsibility very seriously and do not be afraid to speak up if anything seems unusual. Your patient is depending on you, and your surgeon is depending on you.